Second illness, that's the skin disorder. It not only happens in a new baby, it possibly happens in like young children, or even sometimes happens in adults. For Chinese name, 赤油丹. 赤 is red color. 油 is moving. 丹 sometimes we can use kind of pills. In here, there is kind of like a patches there. So moving kind of patches, red color. So that's generally for this illness name. The special words for Chinese specially used for children, not for adults. Then let's see what's the illness it is. So that commonly happens in the new babies, and they have red skin. Look like a cloudy shape, like a big eye, and commutable. So that's the picture we can see. So truly, this big eye is more red here. But they also possible mutable. So that's the illness name we call it. But here we're only talking about new babies problems. So that's the problems caused by skin infections, or maybe umbilical kind of problems. So that's still kind of infection. That's the part originally relationship with the mom. After delivery, we need to cut off. But that's the weaker part, pretty easily cause the infections. And then maybe some eczema, yeah, especially happens on the hip part. So it's not a special season have this illness, not like an infected kind of illness. It can happen like any time of the year. But truly, it's more higher happens in the summer and autumn. So because in that time, the weather is more heat and pretty easily cause infection kind of illness. People easily sweaty, and the passengers easily like evading internally by the skin. So generally speaking, this illness is not that severe kind of illness. Mainly they can recover. Just occasionally maybe still cause the severe kind of damage in there. So that's basically for this illness. For Western medicine, that's bacterial infections. Yeah, that's bacterial infections. But generally say the infections superficial of the skin is not that different. Another illness, the invading deeper of the skin. So that's by Western medicine. Then we're talking about etiology for TTM. So mainly cause these problems belong to external passenger evading. Mainly is wind heat. and mainly maybe some heat toxins. So that's the main reason. And also we're talking about the infant skin. It's pretty weaker. If we are not pay attention to take care, it's pretty easily to damage. So that's coming from body vigor, combination with external passengers, weaker skin certainly easily by evading from the passenger. So then we go to different type. Then we go to different type. First type is wind type. Wind, heat, or fear condition. So the symptoms, common symptoms, certainly the firstly, the skin has some disorder there. Now we're talking about new baby skin disorder. So local redness and some swollen and some burning sensation there. Does look like a cloudy and may mutable. And also children have some heat symptoms like irritability, like a fever, and also may cause the vomiting, diarrhea, or maybe constipation, depending the condition. Tongue is red tongue. Tongue coating is yellow or maybe some greasy coating there because heat pretty easily combination with the dampness of phlegm. And we're looking for the index finger. The color is purple. With a purple color, more go to heat condition. The treatment principle, clear heat and detoxins. So that some heat toxin evading inside. So acupuncture points, Li11, clear heat points. Li4, with still moving T. And 214, clear heat. Clear heat. 214 can clear external heat and internal heat. Li4 also can relieve external wind passenger, dispersing wind. We can combination with lung 7 together, or even some wind points, like gallbladder 20, or maybe bladder 12. And the infants always body weaker. We got some spleen tonify there. So that's the first pattern. Then we're talking about the second pattern, poison spending. And that means some heat passengers invading internal organs. So this pattern is truly little bit more severe compared with last pattern. So local skin still red is swollen, painful, and the patient may be fever and irritability, don't want to sleep, don't want to sleep. And maybe caused some dizziness, headache, some other symptoms. And for the infants, we're talking about high fever, pretty possible cause convulsion, internal wind symptoms, and the dry lips, dry mouth, red tongue, and finger pincers, still pupil, even more darker. Yeah, even more dark. So this pattern will clear heat, remove toxins, and extinguish wind. So we're talking about the patient possible convulsion that belong to internal wind situations. So acupuncture, clear heat, we still use Li11 and lung 4, Li4, yeah, and Li4. Relieve external passengers. And do 14, clear heat. And gallbladder 20, especially for wind condition. Certainly, we still have some other wind points, even some other gallbladder points, like gallbladder 34. Still good points for these kind of conditions, like infant convulsion. So these conditions will be like more dangerous, especially high fever convulsion. Maybe need emergency kind of treatment, sending to the hospital, call 911. Not only treat for with acupuncture. And also we can bleeding. So excessive heat condition is always good for bleeding. So we can bleeding for this one also. So basically for this illness, we only have two patterns. Preventing, yeah, we're talking about preventing. So generally say we just keep the skin clear and dry, especially for the butt area. That area pretty easy cause the infection and pretty easy damaged for the new babies. And if for some reason skin is injured, we need to clear that region, dry it. And also we can use herbs, yeah, herbs got locally for the ulcers so that we can use. And locally let it be like put the herb liquid in there. So that's generally preventing. Then we're talking about the nurse care. Yeah, nurse care. So basically, if patient truly have this illness, so that we're talking about redness, moving kind of patch on the skin. So we need to pay attention to watching that local area, and also pay attention to see if patient have other symptoms and signs, preventing some complications, like we talk about high fever, or maybe high fever can cause convulsion. So that's with a high fever kind of patients. We can use physiology kind of way, reducing the body temperature first. If still not working, then can use some medications, reducing the high fever. So we're talking about for the children. They are pretty easily cause convulsion. when they have fever. And the children have problems pretty easily cause high fever. So that's why the children convulsion kind of situation happens pretty commonly. So we need a very attention for like children have high fever. Give enough water, and also we can give some supplements like vitamin, or maybe if a little bigger baby can eating some fluid, but very young baby like just bird, we still can put some vitamin in there and with some warm water, not too cold, not too hot. So that's basically for this illness.